Not every minor ache or pain requires a trip to the doctor, but some seemingly minor signs shouldn't be ignored. When it comes to the following health symptoms, keep in mind the old adage, when in doubt, check it out. If you experience any of the following, you should probably get an evaluation from your doctor. Your primary care physicians know your medical history and can determine if it's something to be concerned about, and if necessary, refer you to the appropriate specialist. Hello dear viewers, welcome back to our channel. Today we have brought you 10 important body signs or symptoms that you should never ignore. So watch the video until the end to never miss a thing. If you are new to the channel and if you like what you see, please consider subscribing to our channel and smash the notification bell so that you'll be the first one to be notified when we upload new videos. It takes a lot of time and effort to make these videos. Your subscriptions, likes and shares are what inspire us to create more content. Therefore, please consider subscribing to our channel if you haven't already. Getting to our listing of symptoms you should never be ignoring. Number 1, chest pain or discomfort in the upper body. Unlike the movies, most people with a heart attack don't suddenly fall to the ground clutching their chest. Symptoms often come in slowly, and people may describe an uncomfortable pressure, squeezing or pain in the center of the chest that lasts a few minutes or goes away and comes back again. Sometimes the symptoms are felt more in the neck or in an arm. Women may be more likely to experience symptoms such as nausea or vomiting, back or jaw pain, or shortness of breath. It is not uncommon for people suffering from a heart attack to break out into a cold sweat. A heart attack is a circulatory problem and it is different from a cardiac arrest, although the two terms are sometimes mistakenly used interchangeably. In a cardiac arrest, a person is more likely to suddenly fall to the ground because the heart suddenly stops beating or starts beating abnormally. A defibrillator is needed to get it beating again, and hence only CPR should be performed to the beat of staying alive until emergency services arrive. If you suspect someone is having a heart attack or has had a cardiac arrest, call 911 straight away. Many smarter and fast actions can save lives. Number 2, the worst headache of your life. Almost 1/2 of the world's population has some type of headache disorder. That's a lot of headaches, and trying to sort out dangerous headaches from minor headaches is a challenge faced by physicians every day. But there are a few red flags or warning signs that should be taken seriously even if you suffer from headaches regularly. Call 911 or go to the emergency department if anyone describes their headache as the worst headache of my life, or if their headache is accompanied by other symptoms such as neck stiffness, personality change, or a loss of function of just one area of the body such as an eyelid dropping, speech or balance difficulties. Also see a doctor or healthcare provider straight away if you are over 50 and this is your first headache, or younger and headaches are interfering with your daily life. If the headache came on immediately after an activity such as weightlifting, aerobics, jogging or sex, or you experience headache soon after a head injury. If your headache worsens with time. If you have a severe headache that seems to stem from just one eye and that eye is red. If your headaches are accompanied by vision problems, weight loss or pain while chewing, and if you develop headaches after having cancer. Number 3, dropping or weakness down one side of the body. Every year, about 795,000 Americans suffer a new or recurrent stroke. That's about one stroke every 40 seconds. A person's chance of survival after a stroke are greatly improved if somebody recognizes their symptoms quickly. FAST or FAST is an easy way to remember the sudden signs of stroke. F. Pace dropping. Does one side of the face drop or feel numb? Is the person's smile uneven? A. Arm weakness. Is one arm weak or numb? Does one arm drift downward when both are raised? S. Speech difficulty. Is the speech slurred? Can they correctly repeat a simple sentence like the sky is blue? T. Time to call 911. Note the time and get help fast if someone shows any of these symptoms. Number 4. Shortness of breath or wheezing. Many different conditions can affect your breathing, although most causes are not dangerous and are easily treated. If that breathing difficulty is new or getting worse, or if it may be a sign of something more serious. Call 911 if somebody stops breathing, is having serious difficulty breathing, or if their breathing difficulty has come on suddenly. Urgent attention is also warranted in people with a known condition such as asthma, whose usual reliever medications are not helping, or in people with chest discomfort accompanied by shortness of breath. Number 5. Weight loss with no good reason. Weight loss is to be celebrated if you have been working out every day, eating healthy to try and lose weight, or following a specific diet. But if you are just sitting around doing nothing much, eating what you normally eat, but your weight seems to be falling off, get it checked out. Unexplained weight loss could be a sign of stress, depression, infection, cancer, a digestive disorder, or a side effect of some medications. Number 6. Pain in your abdomen that persists or recurs. There are many different conditions, some serious, others not so serious, that cause stomach pain. Less serious causes include constipation, food allergies or intolerances, food poisoning, indigestion, irritable bowel syndrome, and stomach viruses. More serious causes include appendicitis, bowel obstruction, cancer, stomach ulcers, inflammatory bowel disorders, and kidney stones. Bear in mind that how bad your pain is does not always reflect the seriousness of the condition causing the pain. For example, a stomach infection can cause severe stomach cramps, whereas colon cancer or early appendicitis may only cause mild pain or no pain. See your doctor if your abdominal pain persists or recurs. Number 7. Tenderness, pain or swelling in one or both legs. Almost all types of pain, swelling or tenderness in the lower limbs need to be investigated further by a doctor. However, causes vary greatly in urgency and severity. Generally, symptoms that come on suddenly occur just in one leg, or that are accompanied by chest pain, difficulty breathing, or confusion warrant a visit to the emergency department, as they may be a sign of a blood clot such as deep vein thrombosis or a DVT or a heart condition. If the swelling or pain has come on gradually, see your doctor as soon as possible. Common causes include arthritis, drug side effects, heart failure, injury, kidney problems, poor circulation, or pregnancy. Number 8. Blood mixed with feces in the urine or non-menstrual bleeding. Blood occurring in places where or when it shouldn't is always a warning sign. Blood on or mixed into your stool can occur with hemorrhoids, anal fissures, stomach ulcers, inflammatory bowel disease, or colorectal cancer. Bright red blood usually indicates bleeding near the rectum, whereas dark or tar-like blood mixed in with the stool indicates bleeding higher up in the colon or small bowel. Blood in the urine may turn toilet water red or pink. It may be a sign of a kidney, urinary tract, or prostate problem, or occasionally the result of a bleeding disorder. Bleeding in postmenopausal women or constant bleeding in women of childbearing age always warrants further investigation. Causes include fibroids, hormonal medications, inflammation or infection of the cervix, ectopic pregnancy or cancer. Number 9. Change to your breasts or nipples. Breast cancer is the second most common cancer in American women behind skin cancer. Hundreds of thousands of women are expected to be diagnosed with either invasive breast cancer or carcinoma in situ, the earliest form of breast cancer, each year. Early detection is the key to survival, although there is some controversy regarding when screening should begin and how frequently it should take place. The American Cancer Society recommends women aged 40 to 44 have the option to start screening with a mammogram every year. All women aged 45 to 54 should have a yearly mammogram, and once past the age of 55, women can either continue to have yearly mammograms or opt for biennial or 2-yearly mammograms. Women who are at a high risk for breast cancer should get a breast MRI and mammogram every year, typically starting at age 30. These guidelines do not apply to women who are at high risk for breast cancer because of an underlying genetic mutation or a strong family history of breast cancer, a history of chest radiation at a young age, or with worrying symptoms. These women should get mammograms or undergo other imaging procedures at a frequency agreed upon with their doctor. A woman should be aware of the normal look and feel of their breasts and report any change to their doctor. Changes may include a lump, thickening or tenderness in or near a breast or armpit, breast or nipple skin change, ridges, dimplings, pitting, swelling, redness or scaling, nipple discharge, unusual breast tenderness or pain. Number 10. Feeling like there is no point. Depression is very common, affecting 1 in 10 Americans. Left untreated, it can cause a downward spiral of worsening mood that can be hard to pull yourself out of. Symptoms include feeling of helplessness or hopelessness, self-loathing, loss of motivation or interest for activities that you once loved doing, appetite or weight change, sleeping disturbances, feeling tired all the time, and reckless behavior. If you ever feel like there is no light at the end of the tunnel and this feels like the easiest end to your pain, help is just a phone call away. Talk to skilled trained counselors who are ready to help you find a reason for living. And finally, don't wait. Act now. While nobody wants to get sick, it happens to all of us every now and then. The one thing all these symptoms have in common is that your chances of survival are greatly increased if you act quickly. Some things just can't wait until tomorrow or next week. See your doctor today. Well, dear viewers, there you have them. 10 important body signs or symptoms that you should never ignore. Share us your thoughts in the comment section. By now you know that our channel is full of inspiring videos which you can apply in your life from time to time. If you like our content, please consider subscribing to our channel if you haven't already, and also smash the notification bell so that you'll be the first one to be notified when we upload new videos. It takes a lot of time and effort to make these videos. Your subscriptions, likes and shares are what inspire us to create more content. Therefore, please consider subscribing to our channel if you haven't already. And finally, thank you for watching until the end. We look forward to seeing you in our next video. Until then, stay safe and stay blessed.